Hi, I'll be going to Northern Westchester Hospital this morning to have a laminectomy and fusion of the L4, L5 vertebrae. I have spondylolisthesis of the L5 vertebra, meaning that this vertebra is no longer held in place by the disc above it, but shifts out of alignment, pressing on the nerve bundle. My symptoms were pain across my lower back, radiating down the backs of my legs, and pain also in my buttocks when standing or walking. I've been doing an hour a day of intense core exercises for the past year, but this didn't help. I've taken meds and did an epidural, none of which helped. I'm an active person and I'm anxious to get back to hiking, swimming, working out, traveling. I'm 71 years old, so this video is one for the mature folks out there. So, see you after the surgery. Hi, it's 8:30 p.m. on the evening of my surgery, November 19th, 2018. So I arrived in the recovery room after surgery about 3 p.m. The surgery took about 2 hours. So I had moderate pain in the recovery room. I called it a 6, and it was down to a 5 by the time I left the recovery room. All of the pain was in the lower back. There was nothing down the legs or anyplace else. I had a PCA that I was triggering pretty regularly, but I was really quite comfortable. My vitals were fine, and I had good strength and motion. So when I got up to the room, shortly afterwards, I did a walk with the physical therapists. Took me on a walk down the hallway, and wasn't particularly painful. I certainly avoided any kind of bending. I was finally able to pee around 7 p.m. Using a bedpan. For a short time, I had pain around the neck and shoulders. It felt pretty uncomfortable. But I found that putting an extra pillow behind my neck really helped with this. So my pain now at around 9 p.m., I'd say it's no more than 4, and it's only in the lower back. So far, the first day is much easier than I expected. So we'll see how the night goes, and I'll report back tomorrow. Hi, it's 8:30 a.m. on the day following my surgery, and I continue to have relatively little pain. I've been surprised. I did have a problem with peeing last night. I was peeing frequently, but would pass only small amounts of urine. And by 6 a.m., I was having pain coming from the bladder. So they did an ultrasound, and that showed that I was retaining a lot of urine. So I was getting a catheter. First time I've had a catheter when I was awake. And that did empty me out. So I've been getting up and sitting in a chair. And my doctor came by this morning. He said that when he went in, he found that my spine was pretty arthritic relative to other patients he's seen and relative to what he thought it would look like. So he, of course, cleaned out all the arthritic material, and they're going to cut off my PCA machine today. And also I'll be working with the physical therapist on climbing stairs. Hi, it's about 10 a.m., 2 days after my surgery. So I had a great night's sleep. My back was very tight when I woke up, but it's much better now. I have a pretty low level of pain when I'm lying down, sitting, standing, or I'm walking. Sitting up, as getting up from the bed, is painful. So I haven't had any pain meds except Tylenol since yesterday morning. I'll be going home tomorrow. so I'll shower tomorrow morning before I leave. Surgeon says that I should have pain around the surgical site for another 10 days, but it should be fine after that. He told me that I shouldn't worry about undoing the surgery when I sit up. Although it's painful, that pain isn't a sign that I'm hurting anything. He says the fix is pretty secure. Hi, it's 8 a.m. on the third day after my surgery. I'll be discharged this morning. I slept very well the last 2 nights. I'd say I got at least 8 hours sleep. I don't have a lot of pain. My lower back is very tight. But for example, when I did the log roll to get out of bed and sit in a chair, it wasn't particularly painful. So I shaved and brushed my teeth. I went for a walk in the hallway. I've been peeing and moving my bowels without a problem. My back does feel stiff in whatever position I'm in, and the surgeon says it will probably be like this for about 10 days. But I'm in a lot better shape than the video logs I watched would have led me to believe. So, okay, well, next time I report, it'll be from home. Okay, bye. Hi. So it's about 10 a.m. on the 4th day after my L4, L5 spinal fusion and laminectomy. I went home from the hospital yesterday. So starting yesterday evening, I felt that the level of lower back pain was increasing, around the wound healing, but also generally, spinal pain. A lot of people seem to report that pain increases around the third or fourth day and then begins to level off or decline after about 3 more days. So this may be the bad part of it. Sleeping wasn't bad. I slept through the night. I alternated between sleeping flat on my back and using a triangular pillow. Sleeping flat may have been slightly easier, and I put a pillow under my legs to elevate them a little. That was more comfortable. So I've been getting up to walk around. I'm in a finished basement, so there's plenty of room to walk around. And I climbed the stairs from the basement up to the first floor where there's a bathroom and kitchen. But the act of moving to a sitting position in bed or standing is painful. So I'm walking very slowly as the slightest jarring of my spine is painful. I took a couple of pain pills yesterday and I had one this morning. So when I'm just sitting, which is what I'm doing most of the time, it's really not bad. When I'm just sitting, I'm not having a lot of pain. Good morning. It's about 9 a.m. on the 5th day after L4, L5 spinal fusion with laminectomy. So I got at least 8 hours of sleep. I've been sleeping very well every night. I woke up a couple of times and I used the time as an opportunity to walk around and get my legs moving. I'm walking very slowly, as any quick motion triggers very sharp pain. I feel pain as I put weight on each leg. It's right in the back of the legs. And once I'm up and walking, it's not so bad as long as I move slowly. It's getting up and down, changing position that hurts. So it's really, I describe it as a shooting pain in my lower back and legs. And once my knees are locked, it's not as intense. And when I'm rising, I can reduce the pain by putting as much weight as I can, on my arms or my hands pushing up. I don't think there's any chance of violating the BLT restrictions because bending, lifting, or twisting are the last things I would want to do. Any time I even begin to do anything like that, the pain is really pretty intense. So stairs are definitely harder than they were just after surgery. The act of putting weight on each leg is painful. So I've been taking, yesterday I did take a couple of the 5 milligram oxys. And, it's enough that it takes the edge off of the pain so that I can tolerate the changes in positions between sitting and standing. So, it helps me get up and move to do that. So I think it's worth taking the oxy. So when sitting or lying down, I still have very little pain. That's very tolerable. I can sit like that. Some people, when they're lying down, say that they feel like they're lying on a brick. I don't feel that. I feel like I'm lying on an area of irritation. And the pain's not bad enough for me to think that there's anything abnormal. I've had other orthopedic surgeries, so this doesn't seem out of line at all. But I would definitely say that this is, of the days post-surgery, so far this morning, I definitely have more pain than I have had previously. So I'm going to plan to take some pain pills today, and hopefully in a couple of days it'll start healing, and that intense pain will dissipate. Hi, it's about 10 a.m. on the 6th day after my L4-L5 spinal fusion with laminectomy. One thing I forgot to mention is that you should expect some bloating. I had that right from the beginning. I had to let out my belt at least 2 inches. So, you can expect that. Also, I've been moving my bowels easily every morning after coffee, and I've been peeing normally, so no problems with that. But I wish I could report that I've been getting better every day. I can't. Last couple of days have been worse than immediately after the surgery. So in the hospital, I was walking easily, but now I get shooting pains up the backs of my legs with each step. It's completely bilateral, equal in both legs. So standing up and sitting down is very painful. It definitely helps to take the weight off my back by using my arms or my hands to support myself, in the arms of the chair or on a table if I'm sitting down. My understanding is that there's a plateau that happens during the healing, and I'm assuming that I'm on it. The doctor says it should start getting better after 10 days to 2 weeks. So I'm taking plenty of extra strength Tylenol, and I've been taking 5 milligrams of oxycodone. So yesterday maybe I took 2 of them. It's turning a little more today. I might end up having more today. I definitely feel that I need it to keep moving. And I try to get on my feet at least once an hour. So I walk slowly. I'll walk around for maybe 5 or 10 minutes. But it does seem important to keep moving. So I've been sleeping very well, still alternating between an inclined pillow and just lying flat on the bed. I showered yesterday. I used a long-handled sponge to wash. It wasn't a problem. And I had my son change the dressing. It just gets covered with gauze and Tegaderm. And so that was pretty easy. Good morning. This is the 7th day after my L4-L5 fusion and laminectomy. So yesterday I said that the pain had gotten a little bit worse. This morning the pain has leveled off, and it might even be a little less than yesterday. So I'm doing about 2 oxys a day, plus I take extra strength Tylenol a few times a day. I slept very well last night, and I've generally been waking twice during the night. And when I do, I'll get up, I'll do a short walk around the room, and I'll pee. Now, I get up slowly, keeping my center of gravity over my feet, and I use my hands to take the weight from my legs. That seems to reduce the pain the most. The incision site is fine. I don't really have any, pain or irritation there. The pain is down the backs of my legs, and I don't feel it when I'm sitting or lying down. Um, anyway, I thought I'd show you what it's like standing up, walking, and sitting down again. So here goes. Let me try that. So I lean forward in my chair and I push up using my arms. So, I put as little weight as possible on my legs while I'm standing. I'm trying to keep the center of gravity over my feet, and I push up. And so if I do it like that, there really isn't much pain. Now, move this back. All right, so hope I get the camera right here. So as my weight shifts, I definitely feel pain in my buttocks and down the backs of my legs. At the moment, actually, I didn't take any oxy this morning, and at the moment, it's not bad. So I can, I feel like I can walk pretty naturally, but as I switch legs, as my weight shifts, definitely feel pain right now, mostly in my buttocks. So that's pretty much how how things have been. I try to walk like this maybe once every hour. I go up and down stairs slowly, really the same way. Good morning. This is my 9th day post-surgery, and I can report that the electric pain, the very sharp pain I felt moving from sitting to standing and vice versa, is very much reduced. So that makes things much easier. I don't feel like I have to prepare myself so much for standing up. And I've been doing a lot of walking. Within the room. I'm still not going, long distances, but I'm doing what feels comfortable. I feel like I'm walking more naturally, and I don't have a lot of pain when I'm walking. There's some, but not a lot. Definitely much less than before. Yesterday I walked over to a neighbor's house to hang out. It wasn't a problem at all. I have, I would say, less general fatigue than I've had with other surgeries, like the hip replacement and rotator cuff. I've been taking 1 5 mg oxy per day, plus extra strength Tylenol. I haven't been using a stool softener. My stool is a bit harder than usual, but I've been very regular. So I don't think there's any reason to use the stool softener. So generally, things are heading in a good direction, but we'll see what happens next. Hi, this is my 12th day post-surgery. I have no pain in my buttocks or the backs of my legs. I'm sitting, standing, and walking very comfortably. I've been walking maybe 30 minutes a day, some of it outside, some of it inside. I could do more, but I don't want to overdo it. One thing I do feel now is that my back feels stiff. That's sort of the major symptom now. And I periodically have a sharp pain on the left side at the level of the top of the incision. But it's not anything bad. It's just, slightly sharp pain. So in general, I'm not having a lot of pain. The incision is healing up nicely. There's no discharge at all on the gauze pad. I've been changing the dressing every day after I shower. And the showers are no problem, using a sponge on a stick. One good thing is I like to write, and that's an activity that's easy to do after surgery. So I feel like I've been able to use my time productively. And, that helps. That's a good feeling. there was bruising on my back, and I noticed after my shower today that that bruising seems to have disappeared. I would say in general, my body does seem a bit swollen. Um, I'm pretty sure that's mostly retaining water or something. But that's really no different from other orthopedic surgeries I've had. So, I'm pretty sure that will go away. So that's the story. I feel like I'm doing pretty well, and I have my appointment with the surgeon um, on Tuesday. This is Saturday, so I'm kind of anxious to see what he thinks. I guess I should just maybe stand up and sit down, walk around a little bit to show you, what it looks like now. So I'm standing up, can sit down. I don't really feel, any pain while I'm doing that. And I can get up and I can walk around. I feel like I'm walking reasonably naturally, swinging my legs. I'm hoping, I think it'll take a long time for the stiffness to go away from my back. But so far, pretty happy with the result. So I'll probably report again. If there's no change, I'll probably report again after I see the doctor. So talk to you then. Hi, this is the 16th day following my L4, L5 fusion and laminectomy. So I've stopped taking pain meds since I'm not having much pain. My lower back still feels very tight in the area around the incision. I'm walking about an hour a day, but generally not more than 20 minutes at a time. I split that up between walking inside and outside. My gait is pretty natural. I feel like my legs are swinging naturally. I saw the surgeon yesterday for my 2-week follow-up. So the x-rays showed that the hardware, which is 4 screws and 2 rods or brackets, and the tray holding the bone graft material, everything is in place. The incision has healed well, and the doctor told me I don't have to keep it covered anymore. Surgeon also said that in about a week or so I could bathe and use a swimming pool. He doesn't believe in physical therapy for this type of surgery, but instead just a gradual return to to normal activity. So the doctor suggested the stationary bike would be fine, and that I could start to introduce some incline into my walking. So that no bending, lifting, twisting restrictions still apply. And I'm going to see the doctor again in a month. At 3 months post-surgery, he'll do another x-ray to see how the fusion itself has progressed. So in summary, I'd say that my original symptoms of pain in the buttocks and the backs of my legs, that pain is gone. I do have tightness, very significant tightness at the wound site, but it's not enough pain to warrant pain meds. The wound is healing nicely. I can walk normally, but I'm not overdoing it. The worst period for pain was between the 4th and 7 days, when I had sharp pain in the buttocks and the backs of my legs, particularly when changing from sitting to standing position and vice versa. So that was the worst period. That was pretty bad. My body appeared to be bloated from the surgery, but I think that's pretty much disappeared. I continue to feel some fatigue, and the doctor says this will likely continue for another month, and that's always been my experience post-surgery. I've been sleeping when I feel tired, and generally I've been sleeping well at night, which is actually kind of unusual for me. Having had 2 rotator cuff repairs, on different shoulders, a posterior approach hip replacement, and an anterior approach hip replacement on different hips. I'd certainly say that the recovery from L4, L5 spinal fusion is certainly easier than any of these other procedures, at least in the first 2 weeks. You'll want to get yourself a grabber. Let me display my grabber. This is an extremely handy tool to get. You can get it at, place that sells medical supplies. So here's a handy item you'll want to get. This raises the height of your toilet seat, and this definitely makes life much easier. So you'll want to get one of these. So here's a picture of the incision 1 week after the surgery. And here's a picture of the incision 2 weeks after the surgery. So you can see that it's healed quite a bit. Not quite completely healed, but getting close. So here's an image from my MRI. You can see at L4, L5 that there's significant narrowing of the spinal canal from the spondylolisthesis, but also from a disc bulge and orthorheic material that you can see on the posterior side. So if you're having the surgery, I hope you have a good experience, and feel free to post comments and questions, and I'll provide further progress reports. So thanks for watching my video.